Here is your stem.
Okay, ma'am.
Both are ready?
Yes, I'm ready.
Okay, so if you've read and understood, considering it communication skills station, please begin.
Hello, good evening. I'm Dr. Fyong. I'm the senior house officer working for Mr. Mann in Manchester Hospital. I'm calling to speak with the vascular surgeon to refer to him a case of an acute ischemia. Please, can I confirm I'm speaking with the vascular consultant?
Yes, I'm the vascular consultant. Please summarize your case.
Okay, the patient is a 54-year-old lady that was admitted for mild diverticulitis, and her symptoms got better when we gave intravenous fluids and antibiotics. However, there was a sudden onset of acute severe left lower limb pain, and on examination, the left limb was pale, and the available investigation shows that the ABG revealed a metabolic acidosis and hypokalemia. And then an arterial duplex we did confirmed an acute limb ischemia, and on ECG, it revealed atrial fibrillation with broad preventricular complex. Our main concern is the acute limb ischemia, which will require urgent intervention, and is the reason why we want to refer the case to you.
Okay, so why you do suspect acute limb ischemia?
Okay, first of all, because clinically there is pain, a sudden onset of pain that is not responding to analgesia. And then with the Doppler we did, the Doppler and arterial Doppler revealed an acute limb ischemia. And then with the background ECG showing atrial fibrillation, it could be a risk factor for an embolism.
Okay, so is it an urgent? Can we send it tomorrow morning?
Doctor, it's urgent because it's likely a critical limb ischemia, and intervention will need to be done urgently to try and save the limb.
Okay, and so you told me that the patient have arrhythmia. So what do you think the cause of that arrhythmia?
The arrhythmia could be as a result of the hypokalemia.
Very well. And do you need the cardiologist to review the patient?
The cardiologist might need to review the patient, but that will be after the transfer, because more urgently we are concerned about the limb ischemia that needs urgent intervention.
Okay, well, and what do you think of her presumed diagnosis of diverticulitis?
Okay, in view of the ECG that is now showing an atrial fibrillation, so it's very likely an emboli would have moved to the mesenteric vessel. So at the moment, we are now thinking is a mesenteric ischemia.
Okay, well, so doctor, what's your differential diagnosis?
Okay, we are thinking of mesenteric ischemia, and also an ischemic colitis or a perforated viscous.
And what else?
And ischemic colitis.
Okay, and so do you want to scan the abdomen first?
They might be need to scan the abdomen later, because at the moment the abdomen is soft and is not tender. But I'll continue serial abdominal examinations, and I'll even order a CT abdomen after doing a renal function test.
Okay, so could it become a mesenteric ischemia?
Yes, it could be a mesenteric ischemia, especially now that the ECG is showing atrial fibrillation.
Okay, and what's imaging to do for that?
Okay, a CT angiogram of the abdominal vessels. After,
what else?
I would do the renal function test first to rule out any renal problems.
Okay,
And
well,
then,
and the yes.
okay. And then keeping in mind that patients who need an urgent intervention, I also do a CT angio for the affected limb.
Yes, if the patient is planned for surgery. So you told the patient have atrial fibrillation. How to manage the atrial fibrillation?
Okay, first of all, I'll identify what could be the likely cause. For this case, is very likely hypokalemia. And then next is I'll control the rate with beta blockers. And then I'll control the rhythm with amiodarone. And then I'll give anticoagulation.
Okay, nice. And what the anticoagulant with the how? I mean the dose.
Okay, I'll give unfractionated heparin, IV bolus, 80 IU, international unit, or I can also give subcut low molecular weight heparin after confirming the renal status of the patient.
And what is the bolus dose of low molecular weight heparin?
18 international unit.
Are you sure?
Yes, I'm sure. It's
And
18.
what the route?
Sorry, I didn't get you.
And what the route? How you going to give the low molecular weight heparin?
Subcutaneous.
Okay. And how to transfer the patient? I mean the type of ambulance.
Okay, I'll use an air ambulance, but if it's not available, then we'll use the ambulance with blue light.
Okay, and what's content?
Okay, I'll make sure it has a CPR set and amiodarone in an infusion pump.
Okay, so please outline the management plan for this patient.
Considering this patient is a critically ill patient, so I'll manage using the CCRIPS protocol following the ABCDE approach, where I'll access and maintain the airway and give high flow oxygen, set up 2 white bulb cannulas and begin fluid hydration and take samples for full blood count, arterial blood gas, renal function test. And then seeing that the patient is hypokalemic, I would like to control or correct that with IV KCl 20 to 40 millimole in 1 liter of saline and continue close ECG monitoring and serial potassium measurement. And then I'll also correct metabolic acidosis and the atrial fibrillation, as I outlined earlier, where I said I'll do a rate control with the beta blocker, rhythm control with amiodarone, and then give unfractionated heparin.
Okay, well, and what will you tell her family?
Okay, first of all, I'll inform them of the current situation, that the patient currently has sudden reduction in blood flow to the left limb, which will require urgent intervention and will need to transfer to the vascular consultant. And then
Okay.
I also counsel them on the possible complications and the likelihood of there could be an amputation also as part of the complications.
Okay, and what is the early sign of ischemia?
Pain, out of proportion pain.
Okay, and okay, thank you very much. You can do that.
Thank you very much.
Thank you.